One of the issues we see a lot in our practice are headaches. I'm going to go over one particular headache we see a lot, and that's stemming from the deep occipitals, or really the base of the skull. So I've got our patient here dealing with headaches. There's a lot of different types of headaches, unfortunately, but when we find a musculoskeletal component of it, which we see a lot, if you're sitting at that desk, you're ending up with that forward head posture, you're putting a lot of stress back here. And so we will do a soft tissue or a muscle assessment of these little tiny muscles called the deep occipitals, what really are the base of the skull. So if you have that, you can feel the bone, the base of the skull there, and right off there you'll feel some muscles. And so we'll get in there, and a lot of times we'll find it really sensitive for the patient. So like on Brian here, we got one right there. It's a little bit sensitive. You can usually tell it's like, oh, that's bothering me. And often we'll see the representation of this as pain behind one eye, base of the skull, kind of hanging out there. And there's some other symptoms and signs we'll see, but a lot of times we'll find that. And then we do something called active release technique, which is a muscle technique where we get in there and we really try to loosen that up. So we're trying to go from a short position to a lengthened to really release that tightness and ultimately tenderness that's causing the pain. Patients really love the aspect when we get in there. I'll kind of get my fingers underneath the base of the occiput there, and then we'll just kind of get in there and traction that, and then lift that head up a bit. And we're really getting into those little muscles like that. And so you'll see us do some of that. Usually about 5 minutes of work, we'll get really into here. And it's just a little more specific and a little deeper than you would get with a traditional massage. Massage can be great. We're going to really get in there and find the problem and release that problem and get into there. Once we've done that, with a lot of our patients, we recommend also the chiropractic adjustment to that area. We do have some patients that don't want that, and that's fine. We've gotten plenty of results with just doing the muscle work with some very targeted exercises as well. But it's really nice to get in there and loosen that up. He's got a spot right here he could tell you. So I'm going to go from a shortened position into the length, and I'm really trying to get in there and free that up. So if you ever feel like your head's a little heavy, you got that dull, achy pain in the back of the neck, you're getting that pain behind what feels like behind the eye, a lot of times it can be coming from these muscles right here, the deep occipitals. And we'll get in there and really free that up for you and release it and ultimately relieve you of your headaches.